If you work in healthcare as a carer or healthcare assistant, the words you use can make a huge difference. The way you speak to patients, families, and nurses can show calmness, respect, and professionalism. Or, if you're not careful, the opposite. In this lesson, I'll teach you how to sound more professional and confident when talking to patients or working alongside doctors and nurses. We'll look at everyday phrases people often use, and I'll show you how to transform them into clear professional English that fits naturally in real medical situations. Hi, my name's Jer, and this is Learning English Pro, the home of medical English on YouTube. On this channel, I'm helping you speak clear, confident English for real careers. There is a guide that comes with this lesson. If you'd like to pick it up, it's available in my YouTube store for $4.99. If you're a member of my student membership, it's available to you right now on the membership tab. You can join student membership for just $4.99 a month. You gain access to my complete PDF guide library and all my members only videos. Okay, let's get started on our lesson. And our first everyday phrase is, he's losing a lot of blood. Now, this phrase can sound a bit emotional and dramatic. What can we say instead? He has significant blood loss. The phrase significant blood loss is calm, factual, and clinical, exactly how medical professionals report urgent conditions. Phrase number 2. She looks really sick. This sounds like it has a bit of personal judgment or maybe some emotional words attached. Instead, we should say, she appears unwell. This keeps your tone professional and objective. It's a polite, measured way to describe what you see. Phrase number 3. He's not waking up. This is quite a casual, informal way to report a patient's condition. Instead, you should say, he's unresponsive. The term unresponsive is the correct clinical description for a patient who doesn't react to voice, touch, or movement. Phrase number 4. She's having trouble breathing. Saying it like this can sound a bit alarmist. Instead, we should say, she's experiencing shortness of breath. This is one of the most common professional expressions used in handovers. Experiencing shortness of breath communicates the same meaning in a neutral medical tone. Phrase number 5. He's gone really pale. This phrase isn't suitable for documentation or for spoken updates. Instead, we could say, he appears pale. This is gentle clinical observation. And by saying it this way, you're removing emotion and focusing purely on what you notice. Phrase number 6. She's not making sense. This can sound almost insulting. A more professional way to report this is, she's disoriented. Disoriented means the person seems confused or unsure about where they are or what's happening. It's the standard word used by medical professionals in reports. Phrase number 7. He can't stop shaking. Like earlier phrases, this sounds very casual and almost alarmist. Instead, we should say, he's trembling continuously. By saying this, you're giving a clear professional image of what's happening. It describes the action accurately without using dramatic language. If you're enjoying this English medical lesson, make sure to subscribe, drop a like and comment. Let me know what area of English you're working in medicine and I'll make a video for you. I'd be only delighted to. Phrase number 8. She's passed out. Passed out is quite a casual and street way to talk about a patient's condition. Instead, we should say, she's collapsed, or we could say, she's unconscious. Both collapsed and unconscious are clear, respectful terms. They explain the situation precisely and are commonly used in emergencies, reports, and clinical settings. Phrase number 9. His heart's beating really fast. This doesn't sound professional at all. A much better way to say it in a professional context is, he has a rapid pulse. A rapid pulse is the medical way to describe a fast heartbeat. It's precise and easily understood by all medical staff, especially during patient observations. Phrase number 10. She's burning up. Burning up again is another casual way we can describe a patient's condition. A more professional way is to say, she has a high temperature. High temperature is the professional phrase for fever. It's objective and measurable, perfect for care notes or verbal updates. Phrase number 11. He's having a fit. By saying this, you might sound disrespectful. A more professional way we can describe the situation is, he's having a seizure. A seizure is the correct clinical term for what people often call a fit. It's more respectful and shows that you understand the medical nature of the condition. Phrase number 12. She's not eating anything. This really doesn't sound professional, and we have a much better way to say it in a medical context. She has a poor appetite. This phrase is commonly used in healthcare records. Poor appetite sounds professional, factual, and avoids emotional overtones. Phrase number 13. He's going to the toilet a lot. This is quite a simple and casual way to describe a patient's bathroom routines. Well, instead, we should say, he has increased urinary frequency. This is a common phrase used in both handovers and medical documentation. It's polite, specific, and fits perfectly into professional communication. Phrase number 14. She can't stop coughing. This phrase is very informal and not suitable for medical reports. Instead, you should say, she has a persistent cough. Persistent means it's continuing over time. This is the right way to describe a symptom that hasn't gone away, especially for reports or updates. Phrase number 15. He keeps getting dizzy. Keeps getting, again, sounds very casual and informal. Instead, we should say, he's experiencing dizziness. This phrasing sounds neutral and appropriate. It describes the symptom clearly without adding emotion or judgment. If you want to review all the information and content in today's lesson, pick up the guide for it. It's in the YouTube store and it's available right now for $4.99. If you're a student member of the channel, you can pick up your guide as part of your membership in the membership tab right now. You can join student membership today. You get access to all my PDF guides, and you'll get a new PDF for every new video that I publish. You'll also gain access to 300, yes, that's 300 of my members only videos with lots and lots of interesting topics covering everything from work related to household and lots more. Phrase number 16. She's bleeding from her nose. This is an incorrect way to report this in a medical context. Instead, you should say, she has a nosebleed. This simple change is more polite and a more professional way to describe this condition. It's the correct term you'll hear and used in care and medical settings. Phrase number 17. He threw up. Threw up is a very casual way to describe this situation. He vomited is a lot more appropriate and is really the proper medical term for this action. It's short, clear, and avoids slang, making it appropriate for reports or updates. Phrase number 18. She's feeling sick. This is not very accurate and could mean several different things. Instead, we should say, she's feeling nauseous. Using feeling nauseous communicates the same thing but sounds clinical and professional. It's a phrase doctors and nurses use every day. Phrase number 19. He wet himself. Using this phrase will lead to a lot of embarrassment if used in front of a patient. A more clinical way to say it is he's incontinent. Incontinent is the correct and respectful medical term. It describes the situation professionally and without embarrassment for the patient. Phrase number 20. Well done for getting this far. She can't control her bowels. This phrase is filled with judgment and not at all appropriate for a medical context. Instead, we should say, She's experiencing bowel incontinence. This phrase is discreet, compassionate, and accurate. It's widely used in healthcare settings to maintain dignity and clarity. Phrase 21. He's not drinking enough water. This sounds judgmental and quite casual. Instead, you should say, he has low fluid intake. This turns your observation into a professional statement. Low fluid intake is commonly used in care records to describe dehydration risk. Phrase 22. She's acting strange. This can sound inaccurate and disrespectful. Instead, we should say, she's showing unusual behavior. By saying this, you're removing emotional language and focusing purely on the observation. Phrase 23. He's fallen again. Here we have another phrase which sounds very judgmental. Another way we can say it is, he's had another fall. This is a much nicer way to report a repeated accident. It's professional, clear, and matches the language used in accident documentation. Phrase 24. We're almost finished. She's in a lot of pain. This phrase sounds very opinion-based. Instead, you should say, she reports severe pain. Using the word reports shows that you're accurately recording what the patient says, not your own opinion. It keeps your language factual and clinical. Now we're on to our final phrase. Well done for getting this far. Phrase 25. He's not getting better. Again, like many of our other phrases, this sounds very casual. Instead, you should say, his condition isn't improving. Condition isn't improving is the kind of phrase doctors and nurses use in professional discussions. It's calm, measured, and appropriate for updates. So there you have it, 25 professional phrases that will help you sound more confident, caring, and capable in any healthcare setting. Remember, being professional isn't about sounding complicated. It's about staying calm, respectful, and clear. Every word you use has power, especially when someone is scared or in pain. You can download the full guide and worksheet from my YouTube store for just $4.99. And if you're one of my lovely student members, you can pick it up right now on the membership tab on the channel page. I'd love to know which phrase from today's lesson will you start using at work. Let me know in the comments below. I'd love to hear from you. For now, I'm Ger and this is Learning English Pro, and I'll see you in the next lesson.